Hello out there and welcome to Your Next Mission video podcast. There's a good chance that the VA isn't the first place you think of in emergency medical care. But if you're a veteran, it probably should be. As you're about to hear, the VA's emergency urgent care has come a long way in the last 15 years. And in some areas, it's the best you can find, bar none. If you're a veteran, you shouldn't miss this one. Stay tuned. We'll be right back.
Welcome to Your Next Mission video podcast, where we tell the stories of those who have served in the past and those who are serving today. From transition to financial wellness, VA benefits to mental health, we cover issues facing veterans, active military, and their families. Now here's your host, the 12th Sergeant Major of the Army and co-founder of the American Freedom Foundation, Jack L. Tilley.
Hello out there, warriors, past and present, and your families, and thank you for your service to our great country. Now, before we get started, I personally want to thank our presenting sponsors, Navy Federal Credit Union, whose members are the mission, and Purdue Global, where you can start your comeback with additional sponsorship from Blue Cross Blue Shield, FEP Dental, and Blue Cross Blue Shield, FEP Vision, and USAA. Together, they make your next mission happen. They love our veterans and families, and as I always say, we love them too. Today, we're going to be talking about emergency urgent care for the veterans, an area the VA has made huge strides over the past 15 to 20 years. And I'm excited to introduce Dr. Chad Kessler, Executive Director of Emergency Medicine for the VA, and Dr. Neal Patel, Deputy Executive Director, Emergency Medicine for the VA. Thanks for joining us on the show.
Couldn't be more excited to be here, Sergeant Major.
Well,
Thank you.
I'm excited just to have you here if I got through that first part of it.
Yeah,
Hey,
we're good now.
We're good now. Before we get started here, though, can each one of you tell us a little bit about yourself? And Dr. Kessler, we'll start with you, sir.
Absolutely. Well, it's more than a job. I love this place. I've been working here I'll have to cover my mouth for that one. It was in the 90s at some point through medical school, and I started seeing veterans at University of Delaware and Jefferson in Philadelphia, and have been here ever since, serving my dad and many others. So I'm a physician in emergency medicine, internal medicine. I'm a dad of 4, live here in Durham, North Carolina. Love it. Beautiful, as I was telling you before, looking out on the lake, and I've worked in the VA for some time, just loving what I do.
Oh, wow. Dr. Patel, how about yourself, sir?
All right. Well, I, like Dr. Kessler, I'm also an emergency medicine physician, have been at the VA ever since I graduated residency, actually. So it's been about 14 years now for me. And I live out in Los Angeles, have 3 kids, and love the VA. It's just, been like a second home for me, and just get to make the system better and better. And so, it's now, I'm coming up my 15th year at the VA.
Yeah. I should have asked both of you this question. Is this the first job you've had after you got out of medical school, I guess? Dr. Patel? Or either one of you. Go ahead.
Yeah.
Neal, go ahead.
Yeah. No, this was the first one. I actually worked with veterans as a medical student and sort of knew, where I wanted to be afterwards. It was the place for me. It's the one place that lets me take care of patients how I want to take care of patients as a doctor without worrying about all the other kind of financial stuff and that stuff that gets in the way of actually delivering good care to patients. And so for me, it was not even a choice. It was that this is like my calling.
Yeah. Dr. Kessler, same question.
Yeah. A lot of us that work in the VA also have affiliations, whether it be UCLA, like Neal, Duke for me, and a lot of our VA physicians across the board, if you all didn't know out there, do have that dual affiliation. So maybe we'll see patients at Duke or UCLA and also the VA. And that's such a benefit to you as a veteran, because you get these amazing physicians, nurses that are in the top tier places in the world, not just the country, in the world, that are also seeing you as our veterans. It's unbelievable. So I've been working with the VA again since 96 in medical school, as the way being at places like Northwestern, University of Illinois, Chicago, Duke, in addition to the VA. But so proud, I don't know what side I'm pointing to, of that VA emblem and logo. And so when people ask you, where do you work? I always say VA.
Well, I got to start out by saying thank you guys for what you do for our veterans. It's obviously you care and you want to do everything you can to make their lives better, so not just their lives, but also their families' lives. Doctor, because this may be obvious to you, but how would you define emergency or urgent care?
Well, this is great. And, I can define it a lot of ways. And there's something you can look up on Wikipedia or Google. Used to be, look up the dictionary. We don't use those things anymore, even though I still say it. My kids make fun of me. But the reality is, in emergency, urgent care is defined as by the veteran or the patient. There's a lot out there in the community that Neal and I have heard over 20, 30 years about inappropriate use of emergency services, urgent care services. I don't buy into that. People say, well, why are you going here? Why are you wasting our time with this? Well, my tooth hurts and it's 2 a.m. and I don't know where to go. So I'm going to the emergency room or I'm going to urgent care. Is that a misuse of resources? No, it's very appropriate for the patient. It should be defined as a patient from the patient. Now, do people misuse the system out in the community? Yes, there are some times Neal and I have seen very healthy people sitting snacking on, flaming hot Cheetos coming in by ambulance. And you're like, man, what's going on? But for the most part, and even more for our veterans, they know what's right and wrong. You've had sick call, you have medical call, medical leave. You know when you're going to the doc and what it's for. We don't want people to second guess when they have belly pain or chest pain. I don't want to waste anybody's time. I'll just sit it out. But we do. That's the problem. We see veterans that are just tough and they wait it out for a day or 2 days or 3 days. And we come in and Neal will see him and be like, oh, I'm sorry, sir. What happened? You can't move your hand. Yeah, well, 3 days ago, I felt something. I couldn't move my hand. And we're like, oh my gosh, why didn't you come in? I didn't want to bother you all. We hear that all the time, Sergeant Major. So if there is something that is bothering you, and you're not sure, come on in. That's why we're here. We love it. If you don't come in, we don't have a job. Yeah. Neal, you have anything you want to add to that?
No, yeah, I was gonna say, look, don't let us define it for you. If you think something is happening that's new, different, and you're worried about it, come to us and let us tell you it's not an emergency. It's not something that needs, emergency surgery. We'd much rather have that happen than you wait, like Chad said, with a stroke, and now it's just too late. So we feel really strongly about that.
Yeah, it's funny you say that because I think in the military you're sort of programmed. All the time I stayed 36 years in the service, and I very seldom went to the doctor to get checked out. And just what you said a minute ago, doctor, if I had something that was wrong, I'd say, it'll work itself out in a couple of days. Yeah, well, I didn't want to get I didn't want to get away from my unit. I want to stay what I was doing, and I didn't want to get away from what the mission was. But
let me add on to that, Sergeant Major, because I think just like you, in your 36 years and all the veterans out there and hundreds of thousands of years of service, you come and you do your job. You don't want to let anyone down. Yeah. In medicine, very similar. I was talking to somebody just this morning. There was no call outs. When you were an emergency medicine doctor, guess what? You showed up for your shift. Yeah. You were vomiting, you showed up. If you were sick and coughing, you showed up because we didn't let people down. I think times have changed and we need to change because right now, if I come to work and I'm vomiting or I'm coughing on somebody, I'm going to cause damage and harm to other people. Similar in the military, if you can't do your duties and other people are relying on you, you can't let them down. And so I guess my quote out to the people, to the audience here is, if something's going on, come let us take care of you. It's okay. There's no weakness. There's no bias or stigma. Let us take care of you. That's what we're here for. And I think we need to get through that.
I got to tell you one story. I'm overseas. I'm on a night road march. I got body armor on, all my stuff, ammunition, all this stuff, and I could hardly breathe. And when I got back, I said, geez, something's wrong. I got to go to the doctor. I had bronchitis. And I just said, I'm on a night road march. Anyway, I did some crazy stuff. Hey, Dr. Patel, if a veteran needs emergency care, how do they decide if the VA is the best choice or if it's, or they should go to, maybe an urgent care or call 911? How do they decide? Or what do you think they ought to do?
Yeah, such a good question, right? So let's kind of go back to basics here, right? So you have chest pain that just started. If you have new symptoms that started in the last couple of hours, you should just go to the closest place, right? If it's something that, is acutely worse or worse all of a sudden, and it's something that you've had before, and you know that you have a complicated history, it's okay to go to the VA under those circumstances. What we don't want is patients who are having heart attacks and strokes where minutes matter. We want you to get to the right place. And that sometimes is your closest emergency department, and that's okay and that's good. That's where we want you to be. But if it's something that has been going on for a few hours and you feel more comfortable coming up to the VA where we have your records and we know what medications you're on, by all means, our emergency departments are 24/7 all over the place. So we want you to come there if it's something that's been going on a while. And I think the other part is maybe you don't know, right? And that's why the VA is standing up these nurse advice lines that veterans can call into and talk to a nurse and kind of get into their symptoms a little bit more and get some professional advice about where to go. In fact, Sergeant Major, what we're doing is, we know it's a whole to do to get to one of our, community ED, our EDs. It's a whole thing to kind of get to, who's going to find a ride, who's going to take me, how am I going to get back? So what we're doing is actually we're putting emergency docs on that nurse advice line, and so that veterans can actually talk to an emergency physician and get on a video visit, and we can do a lot of assessment through a video visit, and we can actually tell you, hey, you know what, this is something that you really do need to come in for. This is something I'll get some labs and x-rays and stuff for, and why don't you come over to the VA? Or we'll tell you, look, sir, this is something that's time sensitive. You really need to call 911 right now, and we're trying to stand that up for veterans across the country. So again, make it really easy for veterans to kind of get that advice from a professional, rather than have to worry, hey, do I go to an urgent care? Do I go to an emergency department?
Yeah. One of the things, I don't know if I told you or not, but I went to emergency room at the VA one time, and it was very helpful. They did a great job. In fact, I thought I had something wrong with my heart. I was really getting concerned. So I said, well, I don't know why, but I said, I'm going to go to the VA. But one of the things I realized when I got there, I had to drive about 35 or 40 minutes to go to the VA. And I thought, geez, I wish the VA, there's a clinic about a block away from me. I wish they would have had a small emergency care so I could have went in there and probably solved my problem in a few minutes. Are we thinking about anything like that in some of the clinics? Because, some of the veterans are a long ways away from a large hospital that has emergency care.
Yeah, perfect question. So this is why we're opening up urgent cares, right? At those CBOCs, at kind of where you normally get your primary care at, because sometimes it is something that you're just like not sure if it's something that, it's not a heart attack, not a stroke. You don't think that that's what's going on, but you want to get checked out and you don't want to make an appointment because it's just happening now. That's why our urgent cares are there. And we're making a big effort to stand up more urgent cares. In fact, just last year, we opened up 5 new urgent cares in the VA system. And we're looking at opening up about 5 to 10 more just this year to serve veterans, right? And so that's a good early point in access to care where we can kind of take a look and see, hey, it might be something bigger, something that needs more aggressive treatment. That's okay. We can transfer you, right? But if it's something that you're kind of thinking it's, not life-threatening, that's when urgent care should come in. If you think it's something acute but not life-threatening, that's urgent care.
Yeah. Hey, Dr. Kessler, when I first got out of the service, I never used the VA at all, and I had a bunch of disability. About 3 or 4 years after that, I applied for disability and all this stuff. So now I use the VA. But if I was a veteran and got out of the service, can I, never use the VA at all? Could I still use the VA as a veteran? Just walk in and say, I need some assistance.
Absolutely.
Okay.
Yeah. And what a great time now to sign up for medical veterans. PACT Act just expanded. We started that a while ago, but it was supposed to roll out in 32, 10 years before, 8 years before. Great time to sign up for medical benefits. See folks all the time. And it's tough. You're departing service, separating service. You got many other things on your mind than signing up for VA benefits. You can just walk in. Of course, you need to do some paperwork and get in, but we'll get you. And once the VA has you, it's so easy. Much better to have you on the books and then not use it than try to get in later when you need it. See folks all the time. My assistant hockey coach, no, I don't really need it, saving it for others. We hear it all the time, but that's why we're here. It is the best when I have veterans that I see that also have a primary care provider in the community. That's wonderful. I'm happy to work with that provider. And you know what? There's some things that we do really great here in VA, mental health, geriatrics, audiology, urology. We see a lot of it. And there's some things that we don't have at every place. We can't be everything for everybody. But what we do really, really well. There was a study recently, British Medical Journal, one of our best journals in medicine, that showed that veterans who got their care at the VA, who came in via ambulance, did much better mortality outcomes, like they died less when they came to a VA hospital as opposed to the community. Why? because we have the records, because we know them, because the patients get there. They're not worried about other stress like bills and whatnot. So if you can come to the VA and there's not 100 miles from you and it's a whole day, then come see us. Outside of what we said, when you're having chest pain or life or limb loss or something acute, go to the closest. We're homers, but we're not being stupid here. We want you to get the care that you need. And we've partnered with hundreds of thousands of community hospitals. So we don't have to worry about bills. Veterans don't have to worry about bills, and they can get urgent care in the community. Or we can get pre-connected conditions so you can go to the emergency department and get that covered. But if you can get to the VA safely, come see us. It is the best care anywhere, truly. I take my dad, who's a Vietnam veteran, here at the VA as opposed to any other place in this area. And I tell you, Sergeant Major, we got a heck of a lot of good hospitals in this area. So very proud of what we do.
Yeah, it's funny you said that because when I first got out, like I said, I used the VA and they had a problem with TRICARE and all the stuff was going to stop TRICARE. And so I decided to use the VA. And once I used the VA one time, and for the people that are listening, if you haven't tried to utilize the VA hospital system, you ought to go and check it out and see what's available for you, because it's a great system. And the other thing, just like the two people we're talking to right now, they're very personal, they're very friendly, they're very kind, and they really dig into all the things that you need assistance with. What really makes me feel good, though, is they go that extra mile. They just don't stop, say, well, here's what your ailment is, we'll see you later. They go, well, how else do you feel? What else do you need? And so for me, it was just helpful. And I just
dead
enjoy
on,
it.
Sergeant Major.
Yeah.
It's designed for you. It's
Yeah.
designed for the veteran. So my dad, again, combat Vietnam Navy veteran, loves hot dogs. Listen, I don't know, I can't tell you. But you you go to a place and you go to a restaurant and you go to, say, a burger place, you shouldn't order the taco. Right? When in Rome, do as the Romans. If you had a choice to go to healthcare, that's, for everyone and for money and for pediatrics and kids and everything, or you have a choice of a hospital or a healthcare that is designed for a veteran, why would you not go to that place meant for you?
Doesn't make sense.
It doesn't make any sense.
No, doesn't make any sense. Hey, no, that's for sure. Hey, Dr. Patel, I know you live out in Los Angeles. When I think about Los Angeles, I think about all the great medical facilities out there. How does the VA really stack up against, as far as comes to emergent care, how does they stack up against these hospitals? Is it better? Or?
Yeah, you know what my one regret is that my family can't access the VA's emergency care. Because I know out of all the hospitals we have, right, in Los Angeles, all the kind of fancy banners that say it's the #1 hospital in California, all this stuff. I know in my heart that our emergency department, our VA in Los Angeles, provides far better care than the community places. And that's just because that's the way VA is structured. We're all told, from day one, your job is to take good care of veterans. Your job is not to make money. Your job is not to generate these bills or do these procedures or whatever. You do what you think is right for the veteran. If the veteran needs an MRI at 7 p.m. at night, the veteran gets an MRI at 7 p.m. at night. There's no authorization. I don't have to go talk to a bunch of insurance companies. None of that. So I know, as a doctor being on the inside, I know where the best care happens, and that happens in my emergency department in Los Angeles. I have some of the best doctors in the country. People I've easily ratcheted away from other top tier places because they like working in an environment where their job is to take care of patients. That's what we all went to med school for. The VA is uniquely one of those, one of the very few places where that is your job. That's what you're told to do. That's what you're graded on. You're not graded on, how much bills you generated. So it's, like I said, my one big regret, I wish my kids, that I could take my kids and my wife, to my emergency department if were they ever to be sick. Unfortunately, they can't. So.
But maybe someday they'll be able to. I mean, that's my prayer, that we'd be able to do that. So, I want to talk about emergency care for veterans and different than, whether or not it's different soon. But first, we need to take a quick break. So we'll be right back. Don't you guys go anywhere. I want to talk to you more about taking care of these veterans.
You got it.
This is your Next Mission video podcast with your host, Jack L. Tilley, 12th Sergeant Major Army. And if you're enjoying this discussion, please like us. Click on that subscribe button below. And be sure to click on the bell to receive notifications of all of our upcoming video podcast releases. I'll be right back after a word from our presenting sponsors.
You're watching Your Next Mission video podcast, proudly presented by Navy Federal Credit Union, the most trusted credit union owned by members of the military community, serving all branches of the armed forces and their families. Their members are the mission. Learn more at NavyFederal.org. And Purdue Global. You're ready for a comeback, and with Purdue Global, you can do more than take classes. You can take charge of your story, of your career, of your life. Earn a degree you can be proud of and get an education employers respect. Start your comeback at purdueglobal.edu. Now back to your host, the 12th Sergeant Major of the Army, Jack L. Tilley.
Welcome back. We're talking with Dr. Chad Kessler, Executive Director of Emergency Medicine for the VA, and Dr. Neal Patel, Deputy Executive Director, Emergency Medicine for the VA. Dr. Kessler, how is emergency care for veterans different than emergency care for, the general public?
Hear that all the time, Sergeant Major. And you think, veterans are just a patient, right? The 1%, but it is different. And I have a ton of friends in academia, in emergency medicine and community. And when a veteran comes in, their care is different because back pain is not always back pain. We see a largely elderly population, frail, and many people have mental health, and it's very real. And I'll tell you, back in my dad's day, when he came home, you just didn't talk about it. Now we realize when veterans come home, about 70% have some type of mental health. Could be PTSD, could be stress, could be anxiety. There's so much interlaced when people come in. So when someone comes into my emergency department or sees Dr. Patel with back pain, it might just not be back pain. They might be calling out for help. And what else is going on? Why are they taking these meds? We dive a little deeper. What if they had shortness of breath, bronchitis, like you were talking about, Sergeant Major? Well, bronchitis isn't bronchitis. In a 30-year-old person, maybe it's just bronchitis. 70-year-old, maybe it's lung cancer. What about if they served in burn pits? Maybe about they've exposed to fumes for 40 years. We wouldn't know about that if they were a veteran unless we asked. And so we do. And that healthcare is different. And that's why it's so important that you can come to the emergency department or any care at the VA if you can, be it mental health, be it emergency care, be it pulmonary, it doesn't matter. But if you can get in to see us about that, we treat you who you are, like a veteran, not just another number, as Neal was saying before, about I got to see 100 patients a day or 200 patients a day. No, it doesn't matter if we see 1 or we see 100, same type of care.
Yeah. Do you see a lot more patients that with mental issues? Is that the biggest majority of people that come into the medical care?
We do. I wouldn't say the majority, but it's a lot. And even if patients don't explicitly say, I'm coming in because I want to hurt myself, I'm coming in because I'm depressed, it's there. It's there in a lot. Those that served you all understand how challenging and complex and complicated it is, life outside of theater, back home. It is a ton. When you come back and try to integrate and trying to deal with family, with friends, with coworkers that don't understand, it's heavy. And so we need to be able to open up and to talk about it and to say, Dr. Kessler, I'm feeling a little low. And you know what, as Neal was saying before, and Neal, maybe you could talk a little bit about this. We don't wait for people to come talk to us. We actually proactively do this.
Yeah, like when you come to our emergency departments or urgent cares, we're going to ask you about how you're feeling, depression. We know mental health burden is extremely high amongst our veterans. And so we don't want you to have the discomfort of having to try to figure out who to disclose to, who's safe to. We ask at every visit. Doesn't matter what you're here. You could be here for a stub toe, and we're still going to ask you about your mental health if you check into our EDs because it's that important.
Yeah, sometimes people are apprehensive about telling you how they feel. Do you ever? My wife, that I've been married to a long time, she knows more about me than anybody. Do you ever get calls from spouses or somebody says, "Hey, look, I know he's not going to talk about this, but maybe this is something you might want to ask him or see if he's concerned about it or something." I mean, any information like that? Do you ever get anybody call in like that?
Well, we get lots of veterans who come to our emergency departments and they might come by themselves and we might detect something that's off. We'll ask for their permission and talk to their family, right? So this is stuff that we can do, right? We have social workers, we have mental health consultants that help us get that extra history so that we understand the veteran's entire context, right? We know that people don't just live by themselves sometimes, right? There's a family, there's a whole situation, and we can get that. And that's the nice thing about the VA is like, look, we know that's our job, and that we take the time and we have the resources to address those mental health care needs, even if it's in a busy emergency department. A lot of our places have separate areas, and maybe even dedicated mental health resources just for the ED, right? Where they do this day in and day out. So it is the safe space for you to come. And if veterans want us to talk to their family members, by all means, we have your records, we have your phone number. Like we can make those outreach calls on your behalf.
Caregivers are so important, Sergeant Major. You mentioned your wife of many years. Once we do, like Dr. Patel said, get that approval, it is such a valuable resource. And kind of a shout out to the caregivers, because I see more that I learn about life with talking to a wife or a husband or a daughter or a son for their veteran, and how much they know and care. And so we encourage you, when you come to a visit, bring your partner. Bring your son, daughter, wife. Like, that is so valuable. We can't all remember. I can't remember what I had for breakfast this morning. Bring your wife or your husband or your son or whoever helps you, because those caregivers, man, they are so dedicated. They spend their life often without credit, money, compensation, because of love, because of, 50 years of marriage, whatever it is. So that helps us as physicians in VA. Bring your partner, please.
Yeah, I was going to say, my wife, she told me one day, I make all the big decisions. And I said, well, I've never made a decision. She said, well, none of the big decisions come up. She makes decisions about everything. So she's in charge. There's no question about that. Hey, Dr. Patel, to follow up, are there any specialized services we haven't already talked about in VA emergency care that offer to the veterans that maybe the civilians, they don't have or they can't get?
Yeah. So, I mean, there's a ton. We just talked a lot about mental health care. The other part that we do extremely well is care that's specialized for our older veterans, right? Geriatric emergency care. In fact, VA is the largest healthcare system in the country with the most accredited geriatric emergency departments. Now, what does that actually mean? What that means is when you come in and you're over at 65, we're going to do some advanced screening on you, right? We want to catch your risk of falling early. We don't want you to fall and break a hip and then say, oh, well, too bad, you should have had, bed rails and shower rails. We want to do those assessments early when you're there, not for a fall. Similarly for dementia screening, sometimes you don't know that you're having memory loss. If we can do those screens, we can detect that early. You can plan your life, and we can actually therapeutically intervene earlier, right? This is beyond what you would expect in a community emergency department, right? This is the power of being in an integrated healthcare system where we take care of you, your whole health, right? We're not just in the box at the emergency department. We care about you. We don't want you back when you fall. We don't want you to have a heart attack. We're there to prevent these things from happening. And Dr. Kessler and I have sometimes the unfortunate responsibility of taking care of veterans when they are having a acute health crisis. But what really makes our day, great is when we get to actually prevent some of those things from happening in the first place. So, we can actually send you home from our EDs with a walker if you need that, right? What other community place does that? That just doesn't happen outside the VA system. And so we can help you not only in the emergency that you're having, but we're also going to be looking for those warning signs, those early warning signs that veterans sometimes won't even recognize themselves through our EDs. And we're trying to make all our EDs geriatric accredited across the country.
It would seem to me that a lot of the VA doctors stay for their entire career with the VA, and they don't move out and go into other practices.
It's a great job.
Well, it's a good job. But
36 years in the Army, right? You love it.
Absolutely. But the thing about it is you get to know each other, and you get one of the problems, and I'm not knocking anything, but one of the problems in the civilian sector sometimes is doctors rotate so much. Even in the TRICARE system, they rotate a lot. But in the VA, you normally see the same doctor every time. They get to know you. They get to understand what your issues are. And they have, you crosstalk a lot more, and they'll call you up and tell you what's going on. So I think that's certainly very, very helpful.
Well,
yeah, go ahead.
Just to build on that, Sergeant Major, it's a lifestyle choice. So
sure.
We can see patients anywhere.
Yeah.
But we choose the VA because of that service, because of that trust, because honest to God, like I'm proud to come home and tell my kids what I did that day. And that they understand that we're serving Papa or people like Papa and veterans. And that makes me feel good. You can't put a number on that. I'll be honest. We don't make the most money out there in medical community, but nothing matches what we get. So in a little sense, we're being selfish, and that's why a lot of people do. Neal mentioned before, but when we were training, I mean, Neal will know. I don't know if you can see this, but this is what we got. Are they going up, meaning admitted, or are they going out the door? That was our emergency medicine. When they walked in, what do they do? Are they going up or are they going out? That is so far from what we practice in VA.
Yeah.
It's gone. Like, how do we take care of this veteran?
Yeah. Dr. Kessler, the VA have a lot of doctors and staff that I know that have never served in the military. How do you educate them? You got to have some kind of program that educates them about the military. That's important, I know.
It's important as people come in and haven't served. And, we do have a lot of people within VA, VHA that did serve, up to 40% in different hospitals, medical centers. But many of us did not. And so it is important to get people up to speed lingo. Why? Because of trust and connection. A veteran can connect with another veteran so easy. And once you have that connection built, people open up. They do start to tell me about their depression or PTSD or what their back pain is a little bit more, or about sexual dysfunction, about whatever that you might not feel comfortable talking with about this random person, as opposed to someone who served or understands. And so we have this amazing program called Tour of Duty that is flying around the country. Every VA hospital, access to it, more emergency medicine, urgent care docs, nurses, staff. And what it does is give you that background, that lingo, that intro to what it is to be a sergeant major, to be a captain, the years of service, the terms.
Yeah.
So people understand. And I think with understanding comes respect and knowledge. The reason why people fear things, whether in life, in politics, in military, in a nurse and a doc, is you don't understand. Oh, I don't understand what that nurse does. He's probably whatever. Until you sat in his or her shoes. And so by seeing or going through this tour of duty, you get a little sense of understanding. Nothing will change going out and being in theater and combat. But when you can understand a little bit, that's respect. And that means that veteran knows that you took the effort, time, resource, energy to speak that same language, or at least a little bit of it. And that to me means, oh, okay, you know what? Let's give this guy a chance. I'm going to open up, and then we can just provide better healthcare.
Yeah, you must be doing a good job, because every time I go to the VA, they'll ask me a question about what I did in the military or something. And I'll tell them a story, and they'll patiently listen to the story about what, of course I can't talk as long as I want to talk, but I'll tell them about 5 or 6 minutes about what I'm going, and they look me in the eye and they listen, and they understand, and then, and it really, I got to admit, it makes you feel good about the fact that they really care. Now, whether or not it's a doctor or the nurse or administration or whatever, it's they care, and they're just not going to mess around. This is a great discussion. I want to talk about the VA's reputation. Now, we know we need to talk about that, but there's always a but to everything, but we need to take another break. So please don't go in there. Don't leave me. Stay right there. I got a lot more to ask you guys, so I'll be right back in a few minutes. Now, here's a word from 2 more of the organizations that make this show possible.
You're watching Your Next Mission video podcast, brought to you in part by Blue Cross Blue Shield FEP Dental, Blue Cross Blue Shield FEP Vision.
Part of transitioning out is that dental and vision insurance breaks off from your medical insurance.
Vision and dental is very important to be able to enjoy your retirement.
Blue Cross Blue Shield makes the transition so much easier.
And USAA.
A promise is a trust not to be broken, whether spoken with an oath or sealed with a pinky. And after 100 years, we're still taking care of the military community and their families. That's our mission, always.
Now back to your host, the 12th Sergeant Major of the Army, Jack L. Tilley.
Welcome back. We're blessed to be here today with Dr. Chad Kessler, Executive Director of Emergency Medicine for the VA, and Dr. Neal Patel, Deputy Executive Director of Emergency Medicine for the VA. Remember, this is your show. This is not my show. This is your show. Tell us about your transition. tell us what topics you'd like to cover on the show. You can call or text me at 844-424-1134 or send me an email at smatilly@yournextmission.org. And guess what? I'll actually reach back out to you. Dr. Kessler, this has been a great discussion. I said that a minute ago. I've already learned a lot about this great service the VA is really providing to our veterans. But why do you think more veterans don't think of the VA first when it comes to emergency care? And are you really, got to be honest with you, are you fighting a bad reputation?
Well, you bring that up, and I think of Taylor Swift. So outside of Taylor Swift,
Okay.
yes, it's where my mind went, Sergeant Major. I don't know.
Yeah, I got you.
Listen, I do think, I'll be honest, and I do. I think in the past that we've struggled. Now, I think the first question before we address, how is why is that? Well, why is that in the past, you've seen movies like Born on the 4th of July and other stories that come out in the media that talk about different things that have happened in the VA over the years that, were so long in the past or sensationalized and not even true. Listen, we are a transparent organization. I could have something happen at the VA, one thing this tiny, and they'll blow it up, and across the street, major academic medical center, it might happen 9 times in a month, and you don't hear anything. Why? Because Congress and the American people are our stakeholders, are our board of directors. So everything that comes out is transparent, and good, bad, and ugly. Medicine is not perfect. And so that's sort of the why. We've been getting better and better. How many people have seen a Super Bowl ad now about the VA? That's amazing. I never thought that would happen. How about Marvel movies where they talk and glorify the VA and social workers and mental health workers? We are getting better. And this turns out to real. When I coach hockey and my assistant coach, Sean, tells me he's a Marine, I'm not going there. My buddy told me hard. Well, what did you hear? I'll get up in their face. I will. And I'll be like, what'd you hear? And they tell some story that's like a bunch of crap. And you're like, what? Come on, man. This is me. This is Chad. This is the people that work here. Come give us a chance for you that you see it with your own eyes, because I guarantee you, like for my dad, we are providing the best care anywhere. And that's what we need to do. We all need to do to get out in our communities and share the word. Let people decide for themselves, not based on the story they heard 10 years ago. That's silly.
Yeah, I got it. Now I got to tell you my story. And and this happened to me, and I guess I'm smart enough to figure it out. But I was really depressed. You talk about mental illness, and so I'd going through some stuff. And I've told you already, I had post-traumatic stress for a lot of years, and certain things every once in a while I get down on myself. So I thought, well, people always talk about go getting counseling and talk to somebody. Maybe I'll talk to somebody. My wife's usually the person I talk to. So I went to the clinic and set me up an appointment to talk to a counselor. And what really bothered me, the meeting, I think it was supposed to be 10 o'clock. Well, they come out about 9:30, so she's too booked up. You'll have to come back at 1 o'clock or 2 o'clock. And I came back at 2 o'clock. And quite frankly, she didn't see me until about 3:30. And when I went in to sit down, and by then, I'm probably a little bothered by this anyway. So I went in and sat down, and I told her my story, and she looked at me right in the eye. She says, well, I don't think I can help you. And I said to myself, you got to be kidding me. Well, thanks a lot. And I got up and walked out. So that was just one instance that happened. But I tell you, I didn't turn it off. I didn't say, well, all the VA is like that. I didn't judge everything from the VA based on my experience there. There's problems in everything. The other thing I'll tell you is a lot of time the word of mouth hurts the VA. People say things that maybe happened 50 years ago. Well, it's not about 50 years ago. It's about what's going on today. So if you're listening to this podcast, go to the VA. If you're a veteran, go to the VA and check it out. See what's going on. Talk to the doctors. I guarantee that that they'll help you out. As doctors, would you trust the VA emergency department? I guess you talked about, Dr. Patel, you already talked about, would you trust the emergency care with your family? I'm sure you both would.
Yeah, and this is the point you bring up. The VA today is not the VA of yesterday.
Yeah.
There's been a tremendous amount of work done, right? Our systems are modernizing to where we can actually have transparency over appointment access, all the stuff that were issues. We know it's a big system. It's a huge system. There is a bureaucracy. There absolutely is, and sometimes it's difficult to navigate. There's no doubt about that. But we're working to make those kind of interfaces a lot friendlier to veterans. So we're working on things like veterans being able to schedule their own appointments through an online portal, right? You don't have to talk to anyone, or you can call advice lines. So you don't have to walk into the facility to try to make your appointments. We know that that's a huge inconvenience. And so, if I had any kind of plea, is like, give the VA a chance. If you've been there 10 years ago, it's a whole different story. I can tell you from, and Chad can as well, from working in our EDs, how we've seen the evolution, not only of the emergency departments in the VA, but of the whole system. And so, with that transparency, there's a downside. The negative gets amplified, but it also motivates us, and it lets us see where the problems truly are that we can actually fix, that maybe in the kind of private industry sort of gets, hidden over, papered over. We don't have that luxury in the VA, and I think ultimately for the better.
Yeah. Dr. Kessler, you've talked about your father a couple of times during the show. Could you tell the audience a little bit more about your father?
Absolutely.
VA?
Well,
Yeah.
Shout out to Dad. He's with me always. Great man. Like I said, knows his way around a hot dog, influenced so much in my life, tells me so many stories from Vietnam, good and bad. And I remember during medical school, he was 49 and I'm 49 now. So I'll be honest, I'm a little scared, and it influenced me. He developed MS, multiple sclerosis. Not what you want ever, and not what you want at 49. And I remember being in medical school away from the house. And I remember him coming down to the medical school in Philly and our VA and fighting that we didn't have before to get his coverage as a veteran, as benefits in the Veterans Benefit Administration, VBA, for Agent Orange, as it directly relates to MS. And so we spent years studying that. And they found a link, and he's a 100% service-connected veteran now. And what's better, many others are as well, who developed MS from the military. And listen, we see young 20-year-old women who get diagnosed with MS for the first time, not 50-year-old men. It was highly unusual, and his course has been unusual. And we're relating it to Agent Orange, which the VA made a connection and service connected him for that. And since then, he's gotten care. Really never talked about military with me or my sisters or my mom. Like, we just didn't hear about it, as many Vietnam era veterans did. They just did their business, shoved it away in a closet, and went on. It wasn't until that started opening up and talking and hearing about mental health and other challenges. And I think it inspired me then that like Neal said, job out of residency, out as a young doctor, being a leader in the Chicago ED, to run it, and for my boss to say, hey, what do you think if we reshaped emergency medicine here? And I was like, hell yeah, we can do that. And we did. As Neal said, we didn't have any emergency medicine board certified trained physicians in Chicago and LA. I was the first. Neal, I don't know if you were the first. We now have lines of people, and I kid you not, out the door that want to work for us. Why? Because of all the things, because of the mission, because of what we can do, because of that care, not so worried about this time and that billing code, but about what can I do for that patient and the resources we have. And that's why I think it's great. You change that. You change the way we care, and you have that tie. Nothing better.
Yeah. First of all, you guys are so motivated. I love talking to you guys. But you come across of caring and believing and really wanting to do the best you can. And that's my impression to you. I got to tell you a story. I don't know when your father was in Vietnam. I was in Vietnam in 67 or 68, and they were spraying a lot of Agent Orange and all that other stuff. And I was a young kid. I didn't even think about that. But I had a good friend that actually sprayed somebody. He was in the Navy, and unfortunately today he doesn't even know his name, which is a shame. And I think there's a lot of people out there that struggle so much that need help that don't get help. Now, here's what happened to him. His wife called me and says, he's having problems. Can you help me? And being a sergeant major, I do have a few contacts out there. So I started calling, getting people, and I really got the right people. And now he's at 100%. Not because of anything I did. They just need to see him to evaluate him, and they did the right thing. And so he's being taken care of. But if you're listening and you have some kind of concern, some kind of problem, go to the VA, talk to them, see what's going on. Go to the emergency room. You need to go to the emergency room. But I guarantee you they're going to take care of you. There's no question in my mind about that. Dr. Patel, is there any misconceptions or even just a lack of awareness about the VA emergency care? And how do we really, quite frankly, how do we change it? How do we get the word out a little bit more?
Yeah, so I think, what the message we want veterans to hear is, look, if you think you're having an emergency, go to an emergency department. It doesn't have to be the VA. go to the emergency department. But when you're there and they've stabilized you, you can ask the doctor or the nursing team there, hey, can I get back to the VA, right? Have that, put that on them, and then they can contact us to try to get you back. And I think that's, if there's any value in the VA, it's that we take care of you as a whole person. You're not a pair of lungs, you're not just a heart. You're a whole person, and you've earned this care, right? Like that. Don't think that it's something that you're putting us out for. We're here for you. You've earned it. We get the pleasure of listening to your stories and taking care of you. You're making our lives better. So come to us if you don't, as long as you don't think you're dying. Come to the VA emergency departments, and we'll take care of you. That's our promise to you.
I think the other thing is, I've sat on a couple boards of the VA. One of the things they don't do is they don't tell their story. They don't get the word out. They don't tell anybody. So I really, quite frankly, I think you need to advertise, use a lot more social media. Most of the time people find out the VA by word of mouth. But do you think social media or marketing, are we doing anything like that? Either one, Dr. Kessler, want to answer that? Either one of you. Yeah.
They do. It's slow, Sergeant Major. I'll be honest. It's a very conservative organization, as you can imagine. Federal government, so it's slow to get there, and they're very cautious and sensitive, understandably so. And so we need to be cautious with our messages, but also we do need to get out there like you see in Marvel movies or Super Bowl commercials. And so just started text strings and social media, and there's some that we can't do being in the federal government because of ownership, and that's all understandable. So we come with our own limitations. Like I said, we're a transparent organization. I tell that everyone up front as I hire them, the goods, the bads, and the ugly, so they can decide. I don't want to pull the wool over someone's eyes and 3 months later have to tell them something else or for them to leave. We are also, and I think a core thing, is a high reliability organization. That means it's a never-ending story. We're never going to be perfect. We're never going to be, this or that or the other, but we're going to keep working. And it should be a concept familiar to all your viewers. It's the military concept. Journey to higher reliability. We do the right thing for the veteran every time, no matter what it takes. And as Neal said, I just want to be here. I did that. That's it. You all signed a blank check up to and including your life. This is our job. Don't ever feel like you're putting anybody out. This is why we come to work and why we get to smile. I swear to God, I win the lottery the next day, I come back to work. I love it. I love it. This is part of my life. And it gives me something. It gives me the benefit of taking care of my dad and his colleagues and friends. It gives me the pleasure of going home and being proud and telling my kids what they do. It's just such a huge part of my life.
Thank you again. I can't stop saying thank you because you got me so pumped up and listening to you guys here. Hey, everything changes so fast. Technology changes. The internet. Just all this stuff changes. New cars and whatever. What about the future of VA emergency urgent care? What right now? What are you excited about as far as changes there?
Yeah, I can take that one.
Sure.
So a couple of things. There's actually maybe I'm going to try to narrow it down here. So one, we talked about urgent cares, right? Making those access points really kind of accessible to veterans, right? Putting those where veterans are getting their primary care, and where veterans live. So we're working on that. But what's even more exciting is this tele-emergency care that we're standing up across the country, where veterans, all they need is a phone at home, and they can call and talk to an emergency care doctor or provider, right? If they're worried about something, then they can get that advice in real time, right? This is not a callback system. You call, you're going to get to see an emergency care doctor, and we're in the process of standing these up so that veterans can actually get professional advice on where they need to go. And what we actually find is sometimes you thought you needed to go to the ED, and we can actually say, nope, you know what? We're going to send you some medications. Here you go. Or here, we're going to set up this x-ray for you at this, at your primary care clinic that you go to that's way closer to your home. So we can do a lot of stuff virtually that doesn't leave you worried about going to the community, worried about the expense and the bill that you're going to get, or even trying to figure out who's going to give you a ride, all this stuff that, just gets in the way of you getting the care that you need. And so what's easier than talking to a doc over a video phone, right? So really excited about that.
Yeah, it's funny you mentioned up medication. You get older, you got to take something. And if I get down to whatever, a week's left from it, I'll get notified by the VA. It's time to reorder your medication. They're taking that step forward to make sure you're taken care of. health-wise there. So that's, Dr. Kessler, you want to add anything to what he just said, or?
No, that's fantastic. That's the thing that we're most excited about is teleemergency care. And to put it into perspective, if you're an 84-year-old Korean War veteran and, you live 60 miles from the VA, because we can't be everywhere for everyone, like I said, you're coming into the emergency department or clinic, like that's a day. That is literally a day for you. You got to get up, get dressed, get your stuff together, maybe get your partner, get your medicines, get ready, get in the car, drive an hour and a half, which is at risk for anyone, including yourself and others. Get there, try to park, find parking, get set up, get checked in, see somebody, and it goes on, right? And that's a day. It's literally a day. What we can do in 30 minutes over a video or a phone. And it's where you are. Again, some people may live 5 minutes from Durham. Some people may live an hour and a half, and I might not have an emergency department urgent care there. This gives us access to everyone, everywhere with, as Neal said, emergency medicine physicians with that perspective that don't just say, sounds a little iffy, Sergeant Major, you should probably come in. Well, that didn't help me at all, right? I can see on a video that laceration that you've had outside because you're working on your equipment and your gear, your John Deere tractor, and you cut yourself. And I can say, yep, Sergeant Major, you need to come in. We need to suture that and clean that. All right, you know what? Put some bacitration on it, call it a day. Can follow up in 3 days. Like, that's great. How much time and money and effort and energy does that save you to get on and do your day? That's why that's so critical.
Yeah, if I called you, it'd be with a golf club because I'm swinging a golf. Hey, first of all, let me say this is great. Last question, and we'll start with Dr. Patel. If there was one thing you could say to a veteran about why he or she should use the VA, what would that be?
Yeah, really good question. It's like what Dr. Kessler said. This is a system built for you, right? We know that being a veteran and serving in the military leads to different health outcomes, right? And there's different health challenges, both physically and mentally. And we have developed a system, and we're continuing to improve that system that's designed for you. So we take care of you as a whole person. It's not like your community emergency department where it's just the patchwork and then off you go. We want to do the whole care. And so, for anything, I would say, if you've tried the VA and you didn't have a good experience a few years ago, give it another shot. It's an ever evolving, ever improving system.
Yeah. Dr. Kessler, you want to add anything to that, sir?
Yeah, I think, Sergeant Major, that the healthcare in this country, and we're lucky, for most part, is assumed. You're going to see a good doctor and see a good nurse in any of the places around Neal in LA or at the VA. What's different? Do you want to go get treated by a veteran or someone who's, dad is a veteran, wife is a veteran, whatever? Or do you want to see someone who's going up or out? Neal told you about our mission and why we do this. I think that's why I would choose it, or my dad chooses it. Because again, it's designed for you, and you get taken care of by people that care. That's the difference. It's anything, whether I go to the dentist or I go to CVS or I go to Panera Bread or anything, it doesn't even matter. Does that person that working there really care, really take pride in their business, in their healthcare? It doesn't matter if you're earning minimum wage or you're making $300,000 a year. Do you want to get taken care of by people like us who really care and want to be there? Or are you taking care of people who are doing their shift and seeing 30 patients in 8 hours? To me, that's the difference. We're not going to get everything right. That's okay. We're honest. We're human. And I think that's why people should come, for the humanity. The healthcare, again, I think is assumed. But I think the humanity is what people coming back is when you gather around the popcorn machine at the VA and see a battle buddy or see a young veteran that you can influence. Yeah, that's your heart. You can give back. You can give back by coming to the VA. And if that doesn't choke you up a little and give you goosebumps, which it is me right now, then I don't know. But come see us. Write me an email. Well, Neal and I will take care of you.
Okay, I'm sure you will. Hey, if somebody wants to learn, Dr. Kessler, if somebody wants to learn more about learn more about the VA, where can they go?
Yeah, we have so many great communications experts like Megan, who's helped us out, and shout out to Megan and the whole VA comms crew because they're wonderful. And so for care and benefits, you can always go to va.gov. That's probably the simplest. I would flash up a QR code on my phone if I had it. 1-800-MY-VA-411 is the number. If you got an old school rotary phone, just dial it up. It's 800-698-2411. Again, 800-MY-VA-411. And I have to tell you, Sergeant Major, we talked a lot about mental health. So if anyone ever is feeling unsure, unsafe, maybe this conversation triggered something, the VA is incredible. Like 911, which everyone should be familiar with, the VA actually led this, but now it's a community service for all Americans. If you dial 988, you will get to a veterans crisis line or a suicide hotline or anything where you need mental health help. And that can take you right to the VA. So if you need something, or even if you're not sure, give a call. Again, that's why we're here. The VA has spent thousands, millions of dollars so we could take care of you. So drop us an email, call, old school. You can come find Neal in LA or me in Durham, and we would be happy to care for you.
Well, I think on that crisis line, it's 988, and then you press 1 or something like that to get it. Is there a text
you'll
or
get
something?
all instructions, but you're right.
Yeah. Okay. All right. Well, that's perfect. This has been a great discussion. I'm so glad that both. I mean, it just makes me feel better about the VA. I already feel good about the VA. Not saying I'm not. I already feel good about the VA, and I just appreciate you guys coming on and sharing your knowledge about what you're doing with our veteran community. I certainly appreciate it. Any final thoughts? We'll start with you, Dr. Kessler. Any final thoughts?
Yeah.
Something you want to share with the audience?
Yeah. Sergeant Major, for your 36 years plus of service and continuing service, and for the opportunity to come on here, because to me, this is what changes. You talked about how we change. This is it, to reach hundreds or thousands of veterans out there listening to your show because of you, and they get to hear us. Maybe one comes in. That's a win. It's worth every hour of our time. So I'm just thankful and grateful and hope to meet more veterans coming into my hospital.
All right. Thank you, sir. Dr. Patel, how about yourself, sir? Any final thoughts?
And so likewise, thank you, sir, for having us on. To the veterans out there, like I said, give the VA another shot. And look, if you're having an emergency, you think you're having a heart attack or a stroke, please go to your closest emergency department and then let us work it from there. But know that we have VA emergency departments that are tailored for you. And so when you have something going on that you feel like you need help right away for, that's not a heart attack or a stroke or something that you feel like you're fitting to die for, please come and check us out, and let us give you the care, because it makes us happy to do this. And I think you'll find a different VA than you might have found 20, 30 years ago.
Absolutely. Well, first of all, let me say to both of you, thank you so much for I know you're extremely busy every day, I'm sure, but thank you for taking the time to come on the show, because this is important. It's important for you. I know that. I understand that. But it's also important for our veterans to understand what the VA will do to assist you in any way they can. So God bless you. Thank you so much, and hope to see you one day in person.
That's right. Not in the emergency department.
Not in the emergency. No.
Yeah,
Just talking.
yeah.
Have a good one.
Thank you, sir.
All right. Thank you.
Thanks to Dr. Chad Kessler and Dr. Neal Patel for being with us today. I'm Jack Tilley, 12th Sergeant Major of the Army. You've been watching Your Next Mission video podcast, and thank you for joining us today. Log on our website at yournextmission.org and leave me a review. I always say I hope it's a good review, but it's a bad one. We want to make this show better for all of you. While you're here, you can visit our nonprofit and corporate partners who have jobs and services available that can assist you in your transition from the military. And we just added a new job board in partnership with the Recruit Military, where you can search for a job that's a perfect fit for you. Check out this video on our website to learn how to fine-tune your search. You can also create your own individual profile. Scan the QR code on the screen or the QR code on the website to create your profile. All information collected is confidential and won't be shared with anyone. We want to assist you any way we can, just like the VA. All of us, want to assist you any way we can. You can follow me on all my personal social media pages: Facebook, X, Instagram, YouTube, LinkedIn, and I love this one, Rumble. And if you like what we're doing with Your Next Mission, subscribe. Hit that button below. Don't forget to click on the bell too to receive notifications about all of our upcoming video podcasts. Don't forget, we want to hear from you. Please leave me a message or send me a text at 844-424-1134 or send me an email at smatilley@yournextmission.org. Thanks again to Dr. Kessler and Dr. Patel for joining us today. They sure had a lot of great information about the VA emergency urgent care has really to offer for all of our veterans. I need to tell you something. I thought years ago that I'd never use the VA. and I was struggling whether or not I wanted to go to the VA. The first time I went to the VA, I gotta be honest, they changed my perspective on what they do. They care. You listen to 2 doctors right now that says, hey, come and see me. Judge them by your actions, by going and visiting the VA. They'll take care of you. I don't use this word loosely sometimes, but maybe I do. They'd love to have veterans come to the VA and get help, especially if you got some mental issues, especially whatever the problem is. Go check them out. They want to be part of your life, and they want to help you, just like we want to help you. Again, thanks for watching. Thanks to New Mind students and, of course, our sponsors, Navy Federal Credit Union, Purdue Global, Blue Cross Blue Shield, FAP Dental, and Blue Cross Blue Shield, FAP Vision, and USAA. We appreciate all you do for our military. And as always, see you on the high ground. Hooah!
You've been listening to Your Next Mission, brought to you by the American Freedom Foundation. Learn more by visiting yournextmission.org.